Hey everybody, my name is Carolyn Pizoli and I'd like to talk to you a little bit about the Child Neurology Residency Program here at Duke. First, a little bit of the logistics. Our program is a 3-year ACGME approved program in child neurology. We have 2 categorical positions open per year. We have a format of year 1 being predominantly adult neurology requirements and years 2 and 3 focusing on pediatric neurology. In that first year of adult neurology, spend time on the inpatient services as well as outpatient clinics and electives. And we have a 6-week rotation where you come back to the pediatric side onto the inpatient services. Years 2 and 3 are structured similarly with about 6 months divided on our inpatient consults, EMU, and neurocritical care services, 2 months of clinic rotations, and then about 4 months of electives. Throughout all 3 years, your 1 half-day-a-week continuity clinic is on child neurology, allowing you to really get to know your patients over the long term and then really identifying you as their primary neurologist. A little bit about our inpatient services on the pediatric side. They're divided up into the epilepsy monitoring unit, or the EMU. This has the scheduled admissions for spell characterization, surgical evaluation, complex ketogenic diet initiations. And this is a larger team with the epileptologist, the EEG fellow, the pediatric neurology resident, as well as pediatric residents and medical students. Our goal is that over time, you're comfortable running the service as you've gone through your time with us during residency. Next, we have our consult service. And so this is all floor and ER neurology consults. And because they have a primary pediatric team, you're able to focus on the neurology and not antibiotics and discharge paperwork. And you have your 2 years of pediatrics completed whenever you start our child neurology residency portion. And it's time to focus on the neurology. So none of the basic pediatric general responsibilities. And then lastly, at Duke, our neurocritical care service actually sees children in the neonatal, the pediatric, as well as the pediatric cardiac units, all 3 together. Whenever we're on the outpatient clinic rotations in our program, we have, in addition to general neurology clinics, a multitude of subspecialty clinics available to see children in these clinics with the experts in the field respectively, but also a good number of general neurology clinics too. And I think that's important to note because sometimes the most valuable part of, I think, being a subspecialist is knowing the other conditions that can have similar features and being able to really be able to handle and think about no matter what symptom or exam finding or imaging finding that your patient has. And so we have a pretty broad base emphasis as well, but a lot of opportunity to look at subspecialties during your time to start to feel if there's something that you're interested in particular along the same lines. On our elective time, in addition to what's available within our child neurology division, we have the entire adult neurology department, and then a lot of our other divisions within pediatrics and other departments entirely. Psychiatry, obviously, we also have the neuro-ophthalmology. We have neuro-oncology, that's fantastic at Duke. This is also an opportunity for people to learn a little bit more about electrophysiology, whether it's EEG, sleep, EMG. Also, if you wanted to really learn about Botox injections, things along these lines, neuroradiology as well. And then also an opportunity for people who are interested to do a lot of research. A little bit about where we work. So we have divisional offices and a very large dedicated office for our residents. Our subspecialty clinics and your continuity clinic are in the Children's Health Center here on the main campus, just 2-minute walk from the office. And then the majority of our inpatient care is in the Duke Central Tower, brand new state-of-the-art facility built just last year. And that houses pediatrics and the neurosciences. We do still have the infants in the Duke North Hospital for proximity to the obstetrics floor and the delivery rooms. This is our new Duke Central Tower. Again, it's a lovely facility, great spaces for the patients, and it actually it's a pleasant environment to work in, and that is something I've enjoyed. So the hospital itself has 20 pediatric intensive care unit beds, 20 of the cardiac unit as well, 67 neonatal unit beds. We have a very large bone marrow transplant unit with a great deal of cellular therapy being done here at Duke, which means as a child neurologist, you get to see a lot of conditions that we wouldn't always necessarily see. A very large referral base internationally, in fact, for a lot of the conditions that we're doing cellular therapies for. Our general pediatric floor has 64 beds. Our EMU has 8 beds. And again, that's one of our main services that we spend the time on during our residency here. Our pediatric emergency department has 17 beds and is staffed by pediatric ER doctors, which is great because they're used to some of the complex Duke kids that will often get consulted on. And so there's an experience there. If when they call you, you're able to recognize that their examinations, their recognition of some of the neurologic manifestations of other conditions is pretty well vetted, and that helps a lot. Going kind of on to our educational didactic conferences. Our noon conferences are shared between the adult and pediatric programs. We have our dedicated pediatric one on Wednesdays, but the conferences go across the weekdays at noon. We have a specific pediatric neurology journal club where we try to focus on critical appraisal of literature and recognizing the quality of data weekly on Mondays. And then a fantastic little case discussion on Thursdays run by the residents, where we kind of work through some of the thinking of case management as well as diagnostic evaluations, and at the end up having a bit of time to talk about whatever the diagnosis or condition was. That's wonderful. Following that, we have a neuroradiology conference with a fantastic neuroradiologist who's very pediatric focused. That is helpful both in real time for our clinical patients and questions, but an amazing teaching conference as well. Quarterly, we have a half-day divisional retreat where we have about an hour-and-a-half curriculum of trying to focus on guidelines, changes that we want to implement, or topics that are evolving or hot in our field. We also do M&Ms at that point in time and some other career type of discussions. In addition to those very neurology focused program conferences, we do have pediatric grand rounds weekly, the neurology department grand rounds, as well as special conferences, depending on if you're on an elective you're interested in or just want to get a little more experience, as you see here. And then the research opportunities. Research is not required, but it is something that we encourage you to try. We would love it if people were able to participate to some degree in a research and a QI project. Ultimately, we would hope you could be able to get a publication if that's your goal, but it is not by any means mandatory. We want to support that if it is something you're interested in too. And we have our research oversight committee led by Dr. Jeff Russ, and our QI expert is Dr. Kevin Rathke. And within our division, we have a number of fantastic opportunities, including access to the Pediatric Status Epilepticus Research Group, as well as the Neonatal Seizure Registry through some of our division members, but also the neuromuscular clinical trials and some of our other pharmaceutical trials for epilepsy, and a great number of opportunities. And then if you expand out into pediatrics and then Duke as a whole, there's exponential increase in the opportunities. And so if anybody is in particular interested in thinking earlier ahead of time about that, please don't hesitate to contact us. There's a lot more information we'll be able to give you. Similarly, it's not common, but we are absolutely interested in helping anybody who has a specialty track interest. So with epilepsy, neuromuscular disease, sleep, neonatology, or as I said, research, if you know this is something that's a goal of yours and you'd like to design some of your time to start to get that type of exposure and experience early on, we're happy to work with people who know that ahead of time. Again, not commonly done at all, and that's fine, but an option for those interested. And that kind of brings us to the people who at some point, either early on or during their training, determine that they're interested in fellowships. These are the fellowships that we have here at Duke between child and adult neurology. And again, if there's something that you're interested in early on and we can get some of those conversations rolling, we can determine if our Duke Fellowship program is something you're interested in, and then obviously helping you expand out into other programs as well. So that was a very, very fast overview, and so much more detail can be given, but I wanted to talk a little bit about the context that this residency program is sitting in, and that's within our child neurology division. We are out of the Department of Pediatrics, so we have 12 pediatric neurologists with multiple specialties, as you see here, and we have 2 developmental pediatricians and 2, and soon to be 3, pediatric nurse practitioners. Dr. Mohammed Makati is our division chief and is an astoundingly talented child neurologist. He is an epileptologist in that it is his main clinical focus, but also a world expert in alternating hemiplegia of childhood and has a very active basic science research lab in addition to clinical arm in that regard too. And so under his great leadership, we have a ever-growing group of neurologists. Here are our 4 other epileptologists. Dr. Zafar, Rathke, Patel, and Kenny Jung, who all have fantastic other interests in additions to their epilepsy. For example, Dr. Zafar is doing a great deal of pharmaceutical trials. Dr. Rathke does a lot of our QI work. Dr. Patel is actually changed our EEG curriculum and has incorporated that into our didactic series and EEG rotations, and is very interested in education and been a great resource for our program. And Dr. Kenny Jug has specific interest in degenerative diseases and cellular therapies as well. Within our neurocritical care interested group, we have myself. I like all of the units a great deal. Doctors Lemon and Russ actually did some neonatal training after their neurology residencies, but absolutely are fantastic clinicians in the other units, and the 3 of us tend to be the neurocritical care centric group. And I'm doing some work within the other units and trying to develop some projects there. And Dr. Lemon has been extremely successful in her research and is actually in charge of our pediatrics research unit. And so a fantastic resource, again, for anybody interested in learning a bit more about the infrastructure here at Duke available, and an amazing mentor as well. Dr. Jeff Russ is a neonatology trained neurologist as well, who then does basic science in injury and is the chair of our residency research oversight committee, and again, a fantastic resource for working on those types of projects as well as clinical neurology. Dr. Kasuji Gonsagra, I have to note, has built our program over the last many years fantastically. This is my first year as the residency program director, but Dr. Gonsagra is maintaining his associate residency director work here, and are a great team, and he's really transformed the program in so many great ways, and I thank him for that. He is also our sleep specialist and an author, and I believe has a Twitter handle as well. Dr. Edward Smith is our neuromuscular specialist, and I believe the second person to give a child with Duchenne's muscular dystrophy gene therapy, and has been very involved in a lot of the gene therapy trials and other trials in children with neuromuscular disease. And we have a very active multidisciplinary muscular dystrophy association clinic here that he is head of. Dr. Klaus Warner comes here from Germany to London to Toronto and back, and is the head of our tuberous sclerosis clinic that now has a great standard to meet with fantastic interdisciplinary care. That's wonderful to be able to work in, and is a headache specialist and takes real passion to care for these kids. And it's a really important skill to learn as a child neurologist. We have several developmentally focused members of our division as well. Joan Jason actually is double boarded in both neurology and neurodevelopmental pediatrics. and is interested in our cerebral palsy and myelomeningocele populations, as well as starting to do increasing research as well in her career. Purnima Valdez is a developmental pediatrician, as is Dr. Bryn Salter, who have interests in neurodevelopmental disorders and really working for diagnosis, symptom management, and then utilization of services and working with the families in the communities. We're very pleased that by having the developmental pediatricians in our group, we're actually able to increase the amount of time our residents are able to learn from them, which again serves you quite well in general child neurology ongoing. And then we have our nurse practitioners, Lindsay Prung, who works in epilepsy as well as alternating hemiplegia of childhood. Debbie Weaver does general neurology, some urgent neurology, as well as headaches. And we're very fortunate to have Dr. Sid Gosby, who has a world-known expert in some vitamin-responsive epilepsies and an amazing child neurologist who is retired from his long stint as division chief and University of Washington, Seattle, to our area, and so has been an adjunct faculty who's been very active in our didactic teaching conferences, as well as on our research oversight committee, and a mentor to us all. Dr. Avi Lekowicz is recently also retired and adjunct faculty and is a national expert in Fragile X syndrome, which has been something amazing to see her care and passion and learn so much from her on. So I think you've probably noticed, weaved through all of this. We really do try to work with all of our residents, meeting them where they are and what they're interested in, and make connections that are going to be meaningful for them. Every trainee is paired with a career mentor early on, and we meet during the entire pediatrics and neurology training years. And we have our research oversight committee, again, headed by Dr. Jeff Russ, that meets periodically to really help you define, decide, explore, troubleshoot any type of research you may be interested in. Also QI projects as well. And then we have our core competency committee. At the end of the day, our job is to make you be a fantastic, competent, and confident child neurologist. And so we work really hard at constantly reevaluating our ability to not only have people learn throughout their time, but do so in a way that meets all of their goals, and also have a embedded graded autonomy. We really try to have our residents feel as close as you can be to ready to be fully independent by the time you graduate. A couple of words about Durham. It's a great little city and big foodie area. The DPAC, the Performing Arts Center, is amazing and pretty relatively inexpensive tickets for fantastic venues. Got the Durham Bulls sports, rails to trails on the American Tobacco Trail, River State Park, and something about basketball is important to some people around here too. Anyway, between the Raleigh, Chapel Hill, Durham area, you can live in a city, a suburb, you can live in the country. It is an amazing area where you can really fit your own style. And in that regard, it's been wonderful to live here. But I would be remiss to not talk about my favorite things. We're about 2 hours from the beach and 2 hours from the mountains, 3 if you go a little bit further. And it's really accessible and it's really nice. And North Carolina has a lot of great things to offer in that regard too. So all of this is to say that our residents have really built a whole other aspect of our program that is why I wanted to take this job and why I enjoy coming to work every day. These are amazing people. Watching them become confident in their skills and become lifelong learners of this field has been just amazing. And also how they work together. We've really developed a very good culture here of teamwork. And it's been an honor to work with our residents. I get very sad every year when some of them choose to move away after they've graduated. So again, I think our program strengths are our people and our residents and the way they work together, and our division members. Within the residency program itself, we have Latoya Burgess, who is fantastic at helping us navigate all of everything we need to do for the program, and extremely knowledgeable about what we need to do. So an excellent resource, and I'm sure you've all been in contact with her already. Myself and Dr. Consagra, we are here because we love neurology, and we love actually watching our residents become neurologists and seeing them later in meetings, and improving and adapting as things change. And so our education focus is unfaltering. Our teamwork culture is something I really appreciate and recognize is important for enjoying what I do. Our clinical environment from a opportunity teaching standpoint is fantastic. And we have, good set of subspecialists, a great pediatrics hospital. Our other pediatric colleagues are fantastic. And because Duke has several other very specific specialties, we get to see a really wide national, international catchment of number of conditions as well. And then lastly, again, the academic opportunities. Duke's opportunities for educational curricula, mentoring, becoming leaders, pharmaceutical work, in addition to other areas of research, is just immense, as well as advocacy at all levels too. And so it really has a lot more I could tell you about, but please reach out if you'd like to know more. So with that, I want to thank you for listening. And this is our group at the end of June at a hello goodbye party for our graduating residents. And I think these are always the most bittersweet times because you've gained a colleague you will see for the rest of your life, but you've sometimes going to miss them on the day-to-day basis more than you know. So please contact either Dr. Consagra or myself with any questions, and look forward to meeting you soon. Thank you.